Dr. Jaffe, while someone's undergoing chemo treatments, how important is it to keep up their supplements?
Very important question about supplementation and the role of supplementation in people who have cancer and are taking chemotherapy. And there's the answer that Abram Hoffer provided in his book, Vitamin C and Cancer. And then there's the general answer offered by oncologists and cancer specialists. Now, Abram Hoffer, remarkable orthomolecular pioneer, physician, biochemist, and wonderful human being, Abram Hoffer was perplexed by the observation that when his patients with cancer continued intensive nutrient supplementation, continued full dose, full symphony supplementation, they did better. So he did a study, a 10-year study. And if you had cancer and stopped supplements or didn't take them, your survival on average was 6 months. If you did the chemotherapy and took the supplements that Abram Hoffer recommended, which was a whole family of them, you lived an average of 10 years. 10 years versus 6 months? That's a big difference. When you ask, now I'm going to switch to the other side, the conventional misunderstanding by physicians and cancer specialists is that cancer chemotherapy works by oxidatively harming the cancer cells more than the normal cells. And therefore, since cancer works by an oxidative mechanism, you don't want to take antioxidants. They'll interfere with the chemotherapy. That is logical, it's just wrong. And it's wrong on 3 accounts. First of all, Abram Hoffer's study, as published many years ago, and no one has ever challenged his method or his findings. My personal experience is that people who combine chemo with intelligent, intensive nutrition and digestion and attitude do better. And the people who follow the path that says, take none a day and just follow the pharmaceutical guidelines, sometimes they do okay, but most of the time, in my experience, they show the signs of being deficient in nutrients or being deficient in healing responses that, if it were my suggestion or my decision to make, I would include the supplements, the intensive supplementation, and I would include the attitudinal therapies a la Carl and Stephanie Simonton, a la, I'm trying to think who else, Herb Benson's relaxation response for some people is an excellent way in. Active meditation by Bob Leichman, the Western tradition. It's an interesting, complicated question, and I hope that I've been able to address it to some extent.
Thank you. And what supplements would best support patients undergoing chemo?
Well, now tell me what kind of cancer and what kind of chemo and what kind of person and what kind of diet. To me, cancer is what it is. That is an uncontrolled growth. Knowing that every human being makes cancer cells every day, and we have an anti-cancer mechanism operating through cytotoxic T cells and natural killer cells that is meant to surveil, to identify abnormal cancer cells and eliminate them by apoptosis or other mechanisms on a daily basis. So we start out by understanding that you can only have cancer if your innate anti-cancer mechanism has failed for more than a decade, because from the time you have one cell until you have enough cells for someone to say, aha, you have cancer, that's a long doubling time, 1, 2, 4, 8, 16, 32. You've got to get to a lot of cells before they diagnose the cancer. So it's interesting to me that something that can be so helpful and has been observed to be so helpful is so misunderstood. So the bottom line for me is that abnormal cells should be identified, natural killer cells and cytotoxic T cells should be quantified as part of a lymphocyte subset analysis, If you have enough natural killer cells and cytotoxic T cells, then along with enough of the essential nutrients, C-cleanse and polyphenolics, lifeguard tabsules, but also the specific nutrients that you might need to guard your sleep, to guard your mood, to guard your adrenal function, or other specialty nutrients, they're actually more important if you're identifying and wanting to eliminate abnormal cells while also at the same time repairing, rehabilitating, and rebuilding the whole person. So a rethinking of what it means to have cancer and how to manage it is, I think, more than timely in light of the data.
Thank you. And would you recommend the LRA test for individuals undergoing chemo?
I recommend the LRA test for anyone who has an immune defense and repair dysfunction, and cancer is certainly in that category. And when we say immune defense and repair, part of repair is identifying and marking for elimination abnormal cancerous cells. So to me, it makes just common sense that anyone who has an abnormality in their immune system would want to perk up their immune system by having the LRA by ELISA ACT tests and follow the whole program. Substitute for the reactive substances, eat a wide variety of foods to which you're tolerant in a wide variety of healthy ways. Include intensive supplementation, attitude, and activity to evoke human healing responses, and then go by results. Fortunately, we have functional tests now that can be repeated every month, every 3 months, every 6 months, as appropriate, to document that where there's been a defect in the natural repair system, that has been rehabilitated, and that should give people optimism, and we can learn optimism. Learned Optimism is a very good book for everyone, but especially those who are burdened by these kinds of conditions. And so the mind and body are always connected, and we want to use those connections in a way that are efficient, effective, and evoke healing responses.